So you ask the school district for an evaluation for your child for special education and related services. That should be fine, right? Maybe. If we haven't met him, Karen Mayer Cunningham, special education boss, founder of Special Education Academy. We are here to train everyone that sits at the 504 IEP table to navigate and negotiate successful student outcomes. So while we would assume that all of the evaluations are done correctly, it is imperative as a parent to make sure that you ask for them with specificity. And what do I mean by that? So when we do an FIE or an FIIE, a full initial individualized evaluation, you want to make sure that you're testing in all areas. Why? What does testing do? Testing does one of two things. It identifies or eliminates, and we want both of them. So when you're asking for testing, make sure that you have confirmed in writing that this, in fact, is the areas of testing that the school has agreed to conduct. So number one, a full speech and language evaluation to include pragmatics. So we want to test in all areas to see if there's a need. What is a need? When your student has an area of need that's not in the normed and average range, we don't know if there's a deficit if we don't test. Number one, speech and language evaluation to include pragmatic. Number two, medical physical. What's going on with your kiddo medically? Does he take medicine? Is he dispense medicine? Is he on any kind of protocol? Does he have physical needs? Does he have any emotional needs that are being addressed through a physician, through a therapist? Those are pieces of information that you need to supply the school district. Number three, sociological. What is that? That is all the things that are going on with the kiddo that don't exist inside of the instructional day. So maybe grandma has moved in with you. Maybe the last sibling has gone off to college. Maybe dad has been deployed. Maybe mom works at home and the student thinks the mom doesn't have a job anymore. So we want to make sure that we're getting that sociological form filled out by both parents, especially if they're in two homes. Number four, a formal psychological evaluation, or depending on where you are in the United States, a social as an emotional behavioral evaluation. So what do we mean by that? So we all have behaviors. I talk with my hands. We're looking for a behavior that may impede the student's learning or the learning of others. If we don't test, we're not going to find that out. So what could show up in that area as an eligibility: autism, ADHD inattentive, ADHD hyperactive, ADHD combined, or an emotional disturbance. And so if we don't test, we won't know if there's an area of need. We could do an FBA. What is that? A functional behavior assessment. The student has areas of behaviors that are impeding his learning. So we will do a functional behavior assessment to find out what is the root of that and how do we address that. A student might need a behavior intervention plan. A student might need psychological services. Counseling is a related service, social skills. That's why we do testing in those areas. Number five, a formal cognitive evaluation, or IQ. You want to ask for a formal cognitive evaluation to include all 7 Gs. And we'll talk about this in a later training, but the Gs are your brain skills. It's how you are wired. And it gives us information for the educators and how to best implement their education and to make adjustments. Number six, formal adaptive behavior. Adaptive behavior is how you look like your other same age peers: leisure, communication, community, academics, many pieces to see if there's a deficit there. Number seven, formal achievement. So in achievement, we're going to ask for 5 areas. We're going to ask for written expression, math, reading, oral expression, and listening comprehension. And then number 8, related services. And we'll do a bigger training on this later, but related services under IDEA are additional services that the student needs to benefit from his IEP. And those range from Braille to orientation and mobility to physical therapy, speech therapy, occupational therapy, recreational therapy, adaptive physical education, and so on. And so we want to make sure that when you're asking for testing, you address these 8 areas so that your child, in fact, is being tested for a full initial individualized evaluation. We'll see you in the next training.